Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is how spinal decompression therapy works so well. The evolution of spinal decompression therapy began back in the 1990s. Prior to that time, spinal traction was the gold standard for the treatment. And it's often used for back pain and pinched nerve conditions, along with the neck as well. Now, if you look at published research studies, though, it doesn't back it up for the lumbar spine. It does, however, back it up for the cervical spine, and that could be either one of those braces that distracts the neck or the old school one where the rope goes over the door and pulls. That actually has some good published studies to back it up. But in the late 1990s, spinal decompression therapy became FDA cleared, and over the last decade, it has just exponentially increased in popularity because studies are showing that it works great. So what makes spinal decompression therapy different than traditional spinal traction? Well, you can see pictures of both here. And on the left, you have traditional spinal traction, which is continuous traction. Basically, it's just a straight pull, either through the neck or through the lumbar spine. And it can lead to spasms and what's called guarding, where the low back fights, the muscles fight against the traction. And research just doesn't back it up for the lumbar spine. Now, when you look at spinal decompression therapy, on the other hand, what it involves is an intermittent spinal traction. It's not a continuous pull. So what that's been shown to do is avoid spasms and help to distract the vertebral bodies, and there's multiple studies supporting it. So here's a little video showing the traction from spinal decompression that helps pull apart the vertebral body, and you can see the oxygen flowing in, helping to repair, and then it just repeats. So what it does is it distracts the vertebrae and it creates a negative pressure, so you can see it starts to pull in with that negative pressure, and that leads to increased blood flow and oxygen to the disc. So it's non-invasive, there's minimal risk. It usually is taking place in 20 sessions over 7 weeks, and that's through research. Basically, they looked at 10 sessions and they looked at 20 sessions, and 20 sessions actually was shown to be better. The sessions last about 30 to 60 minutes, and they're typically painless. A lot of people fall asleep on the table, and it's computerized settings that are individualized to each patient. And the tables range from $5,000 to $100,000. What you see here is one of the DRX 9000s that has, it's just huge, right? You have all this, like a TV in here, all this computer stuff. But, the ones that are $10,000, they actually work just as well. So indications are if you have a herniated or bulging discs that are symptomatic, it can be very helpful. Degenerative disc disease that's symptomatic can also be helped with spinal decompression therapy. Spinal stenosis, which is where you have arthritis, overgrowing soft tissue and bone and pinching on spinal nerve roots. Facet syndrome, which is arthritis in the joints of the spine. Failed back surgery syndrome, and it works for both the neck and the back. Now, what are the contraindications for spinal decompression therapy? Those who are pregnant should not have the procedure because pulling even intermittent spinal traction through the belly can be painful and cause issues. Severe osteoporosis, the last thing you want to do is actually cause a fracture in a patient by trying to help with pain. And if you've had previous spine surgery and had instrumentation placed, then that's a contraindication. If you've had previous spinal surgery with no instrumentation, then that's not a contraindication. So here's a couple of the research studies. One was done in 1997 by Sheely et al., and it showed that 86% of those with a ruptured intervertebral disc achieved good to excellent results with spinal decompression therapy. And with those who had sciatica and facet arthritis, 3/4 obtained good to excellent results with spinal decompression. And we're not talking about just a week or two of good results. We're talking about 3 to 6 months at least of great pain relief. And then one of the most well-known studies was done in 2003 by Giannis et al., and that looked at over 200 patients, and 86% of those completed treatment and reported immediate resolution of their symptoms for sciatica. And 84% remained pain-free for 3 months after treatment. Physical examination findings showed improvement in over 90% and that remained intact in 89% 3 months after treatment. So the cost of spinal decompression therapy, some insurance companies are actually covering it now. They'll do a carve out, for the procedure. So make sure when you call to ask about it, see if that's the case. And if it's not, a lot of it is self-pay now, and it runs anywhere from $1,000 to $5,000 for a series of treatment, but it has come down considerably from where it was 10 years ago. At Arizona Pain Specialists, it's comprehensive pain management. It's really a one-stop shop. You have board-certified pain management doctors, chiropractors, acupuncture, spinal decompression therapy, physical therapy. There are several locations. There's currently 5. There's over 50 insurances that are accepted, and the doctors have won the Patient's Choice Award 5 years in a row. So call us now for scheduling at 602-507-6550 or visit us on the web at ArizonaPainNetwork.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.